Dr. Lester Machado has dedicated much of his professional career to working to provide solutions and personally providing care to the medically underserved community. His example demonstrates the true value of volunteerism. Since 1990, Dr. Machado has been in private practice of oral and maxillofacial surgery in San Diego. And through his work with Rady Children's Hospital, Dr. Machado has been instrumental in caring for children with cleft palate and craniofacial deformities. Dr. Machado lectures extensively throughout the United States and Europe on many aspects of oral and maxillofacial surgery. He also teaches oral surgery and dentistry to upcoming pediatric dentists in the Rady Children's Hospital Pediatric Dental Residency Program.
At Rady Children's Hospital, we see children with cleft lip and palate deformities, with craniofacial deformities, and it's a real blessing to be a part of the transformation of a child's life from a deformed, harmed, injured child that's shy and reserved to a normal child with full function, able to speak, able to laugh, able to smile, and able to live a full and rich life.
Lester cares about children and young people. He, I know, has done years of work on cleft palate surgery here in San Diego and in other countries.
Dr. Machado has also been an integral part of the Mercy Hospital surgical team's outreach program, traveling to different cities throughout Mexico each year to treat children with craniofacial deformities.
Each year we go to a different city. We've been to cities such as Jalapa, Tula, Zamora, Uruapan. And when we go to the cities, the children and their parents come on the first day and are all screened. And during the course of the week, we take care of several hundred children on each trip. We repair the lips, we repair their palates, and help give them an opportunity to grow and develop as normal children would.
As president of the San Diego Dental Society, Dr. Machado helped draw attention to the needs of underserved children by declaring 2008 the Year of Children's Dental Health.
Dr. Lester Machado was president of the Dental Society when I came on board about 2 years ago. I'd served on nonprofit boards before. I'd managed nonprofit organizations, but I'd never met anyone that was quite as clear in his vision, as competent a leader as Lester was when I came on board.
Fortunately, with all of our members working together, we're able to accomplish great things in 2008. We expanded the number of community clinics in the county. We were able to expand our educational programs for children. We're able to treat and see more children than we ever had before.
During his tenure as president of the Dental Society, he pushed for efforts to finish the move to require fluoridation in San Diego's water supply.
San Diego is the nation's largest city without fluoridation. We had worked for over 50 years to try to get our city council and our population to accept fluoridation of the city's water.
In the fluoridation discussion before the city council, there was a lot of fear on the part of citizens, and the Dental Association and Lester in particular helped me understand the science of fluoridation and the importance of the public policy health issues. And I think that's eventually what got the city council into position to support fluoridation as an important health measure.
We were able to work with our local First Five Commission to establish $13 million in funding identified for fluoridation, which is adequate for the whole county. So we're very pleased to have that happen.
Dr. Machado's passion to help doesn't stop at dental health. He is driven to help at-risk young people in all aspects of their lives.
He's also taken a particular interest in youth and adolescence, and that's a hard age to handle sometimes. I think all the parents out there will recognize that. Sunburst residence near the City Council campus takes homeless youth, most all of them gay, and gives them a safe place in which to mature, spend a little time, re-enroll in their education if they've dropped out of school, and get on the right path. Lester has been a leader in supporting Sunburst and helping those youth get back on the right track.
Lately, in these trying economic times, it's become very clear to me that I don't have to go overseas to take care of a needy child. The great excitement has been taking care of children right here in San Diego. 4% of our children in school are in pain from a toothache. Pain from a toothache. Imagine that in the United States of America. Hard to believe. Those children oftentimes come to the hospital with a life-threatening infection. Their face is swollen, they don't know what's wrong, they're sick, they're in a fever. Usually I'm called to the intensive care unit to see a child close to death because of a toothache. For these children, a cavity is no longer just a cavity, but it's really a difference between life and death. My motivation in this process of attempting to provide better preventive health care for children is so that I never have to do that again, and that some surgeon that comes after me never gets that call again. That we stop the process before it begins. That the child with a small cavity gets treated, that the child with healthy teeth stay healthy, and that our children learn how to eat properly, take care of themselves, and live a full life disease-free.
Dr. Machado is truly an inspiration to the dental community. He is passionate about teaching parents and children the value of good oral health practices. He continues to give countless hours of his time to improve the lives of children. It is the efforts of Dr. Machado and the dedication of many like him that make it possible for the Children's Dental Health Association to meet the needs of the underserved in San Diego.